South Carolina reported a surge to 933 measles cases on Tuesday. State health data showed 13 additional infections since Friday, as officials warned the widening outbreak could last weeks or months amid lagging vaccine uptake. The outbreak, the worst in the U.S. in more than 2 decades, has been centered in the northwest part of the state, which includes Greenville and Spartanburg, and has been fueled by a rise in vaccine hesitancy since the COVID-19 pandemic. But according to state data shared with Reuters, the number of measles, mumps, and rubella vaccine doses administered in Spartanburg County increased 102% over the past 4 months, compared with the same period a year earlier. MMR immunizations statewide were also up 28% during the same period. Yet, Dr. Dimitri Daskalakis, former director of Centers for Disease Control and Prevention's National Center for Immunization and Respiratory Diseases, warned Reuters last month that more immunizations are needed.
I think that we're, going into 2026 with an outbreak that is still hot. I don't think it's slowing down. And I think that whenever you see an outbreak in one state, infections don't heed borders. And so I think that folks that are under vaccinated for measles will be at risk for measles, and that may mean a much larger outbreak.
Daskalakis said that if 95% of the population has immunity, measles can't create a really big outbreak, and also stressed that vaccines remain highly effective.
What I'm more worried about is that, as the folks at CDC are doing the work to respond, we have rhetoric that's coming from the secretary and others in leadership at CDC that casts doubt around vaccine and its ability to prevent infection as well as its safety. And so the vaccine has been demonstrated for decades to have a risk-benefit ratio that makes a lot of sense. It is, no vaccine is free of side effects, but the side effects of the MMR are pretty minimal. And so ultimately, when you have leaders that are touting snake oil, frankly, so untraditional mechanisms of treating or preventing measles as opposed to the vaccine that is 97% effective, the best vaccine we know of to prevent an infection. It almost doesn't matter how good the response is because they're unplugging the integrity of public health.